Hi, so I don't know about you guys, but I generally get a 5 to 7 day period every month where my pain just increases. So I've spent the last 2 days pretty bad. This is sort of my area, but I also find that stress increases it massively as well. So I've had quite a stressful couple of days, so that intensifies things. And when that happens, the only thing I find that works pretty instantly as well, unlike any other tablets, is Oromorph. Um, the only problem is it's incredibly addictive as well. So I now have to sustain myself at 30 milligrams a day just to function normally, and then that increases with my pain. And when the pain increases, because I've become so used to it now over the years, I find that I have to take more and more to be able to cope with it. So at the moment, I'm on probably a level 4 or 5 with the pain, which is just sort of standard for me on a day to day basis. But yesterday and the day before, it was off the chart, it was off the scale. So then you tend to find me curled up in bed and I'm stuck there till it stops, which isn't very pleasant. So that's why I've not posted anything for a while. I've tried a million and one concoctions of prescription medication, different medication, as well as the Oromorph. I'm on a set combination as well, just to cover sort of day-to-day pain. And I've never found anything as effective as the Oromorph. And as I say, that works within sort of about 10 minutes of a flare-up, whereas I find tablet forms can take 30 minutes or more, and that's if they have an effect at all. And I have taken concoctions of high doses of medication. I'm also on tablet form of morphine, which is slow release, which helps with the day-to-day pain, but it doesn't conquer the flare-ups at all. I've not found anything over the past 14 years as effective as Oromorph or a morphine drive itself, where it's given intravenously. So if you are struggling to being able to stabilise yourself when these flare-ups are happening of your endometriosis, I'd definitely consider talking to your GP about having Oromorph, because at one stage I was going to the hospital sort of 3 or 4 times in a week at some points, because the ambulance would come, or I'd go up to A&E, they'd give me morphine intravenously or Oromorph, and then you have to stay in. That's sort of the practice. They have to take you to hospital if they administer it, in the UK that is. Whereas with the Oromorph, I can, to a degree, self-medicate at home. If the GP is open when I have a flare-up, then I tend to go down and they'll give me a shot of pethidine or something else. But over weekends and evenings, when you have flare-up in the night and you don't want to be going to hospital all the time, Oromorph is the solution that I've found, that keeps me out of A&E sort of 2 or 3 times a month, a week. It just depends how bad I am at that point. So I would definitely suggest maybe going down and getting some of that on prescription, even if you just use it in an emergency to start with. It is pretty effective in killing the pain pretty instantly, which is obviously what you want when it flares up, and we know how bad that can be. So that's what I found works for me. If you're struggling, I would suggest maybe checking it out for yourself and see how you get on. But we'll be back with some more poetry and some updates on UCLA in London, with the consultants. He's due to ring me and give me the feedback from the MRI, which will be interesting, and I'll obviously post and keep you updated. And then it's a discussion about what we're going to do next to sort of reduce the flare-ups, if nothing else. So hopefully I'll have some answers and I can feed them back. But take care and God bless.